There are no confirmed cases of COVID-19 in the Democratic People's Republic of Korea, North Korea, though some foreign analysts believe that the virus had spread there by March 2020. Both its neighbors, China and South Korea, had significant outbreaks. Starting in January, the North Korean government took extensive measures to block the spread of the pandemic, including quarantines and travel restrictions. In April, the U.S. analyst website 38 North said this appeared to have been successful. North Korea borders China and South Korea, two countries with early outbreaks. China is North Korea's closest ally, most important trading partner, and a source of tourists. The Chinese-North Korean border is porous, in contrast to the heavily militarized border between North and South Korea. However, suspected COVID-19 cases in the two Chinese provinces, Liaoning and Jilin, bordering North Korea have been low. Diplomatically and economically isolated, North Korea is an impoverished country with a weak healthcare system and is subject to sanctions, rendering it vulnerable in the event of an outbreak. In March 2020, there was concern that widespread malnutrition could exacerbate the spread of COVID-19. In April, North Korean public health official Park Myung-soo said that if the disease spread in North Korea, a serious disaster could not be avoided. The North Korean government is secretive and the media are tightly controlled, making it difficult for observers to determine what is going on in the country. Historically, North Korea has restricted travel in the face of epidemics abroad, such as SARS in 2003 and the West African Ebola virus epidemic in 2014. It eradicated measles in 2018. Its government is totalitarian and maintains strict control over the country and its society, which experts anticipated could help in enforcing disease control measures such as social distancing. North Korea also has many doctors for its per capita GDP, though they are less skilled and equipped than their counterparts in the Western world and in South Korea, and a high level of public hygiene. Expatriates living in North Korea are concerned about potential treatment for COVID-19 since North Koreans are mostly strapped for resources and money, while the option to seek treatment in China is difficult due to travel restrictions and a hefty fee required to enter. North Korea was one of the first countries to close borders due to COVID-19. Starting from the 23rd of January, North Korea banned foreign tourists, and all flights in and out of the country were halted. The authorities also started placing multiple suspected cases, those with slight symptoms such as flu, in quarantine for 2 weeks in Sinwiju. On the 30th of January, North Korea's news agency KCNA declared a state emergency and reported the establishment of anti-epidemic headquarters around the country. Though many parts of the border were closed, the bridge between Dandong and Sinwiju remained open and allowed supplies to be delivered. In late February, the North Korean government said that it would keep the border closed until a cure was found. On the 2nd of February, KCNA reported that all the people who had entered the country after the 13th of January were placed under medical supervision. South Korean media outlet Daily NK reported that 5 suspected COVID-19 patients in Sinwiju on the Chinese border had died on the 7th of February. Within the same day, the Korea Times reported that a North Korean female living in the capital Pyongyang was infected. Despite no confirmation by North Korean authorities on the claims, the country implemented further strict measures to combat the spread of the virus. Schools were closed starting on the 20th of February. On the 29th of February, Kim Jong-un called for stronger measures to be taken to prevent COVID-19 from spreading to North Korea.